Good afternoon, Professor Nguyễn Trung Anh and Professor Boon Sit from Thailand. And I am Nguyễn Văn Đại from Việt Tiệp Hospital. I'm from Vietnam. And on behalf of our team in my hospital, I want to introduce about early outcome of endovascular stent grafting in treatment of aortic pathology at Việt Tiệp Friendship Hospital. As you know, aortic aneurysm and stenotropy aortic dissection are like threatening aortic disease with high rates of rupture and death if not treated in a timely manner. According to the Global Burden of Disease 2021, the burden of aortic disease is increasing worldwide and driven by major risk factors. The main risk factor is hypertension, atherosclerosis, and smoking older age. And nowadays, endovascular repair has become the preferred treatment in a suitable patient, offering lower peri-operative rate and faster recovery. And hybrid procedure combine surgical debranching and endovascular stent grafting expand treatment option for complex aortic pathology. And this is my object, our study to evaluate the early outcome of endovascular stent grafting repair for aortic disease at Việt Tiệp Friendship Hospital. We focus on characterize the clinical presentation, imaging finding, aortic pathology, and we describe the endovascular treatment strategy, including EVA and TEVA, hybrid repair technique. And we assess the technical success, early clinical outcome, and then observation stay in hospital. We determine procedure-related early complication and in-hospital mortality. And we have 37 patients with aortic disease treated by endovascular stent graft at our hospital from January 2016 and March 2026, with include and exclude like this slide. And all patients diagnosed with clinical assessment and monthly CT angiography, and with the V-Ray echo collected like this slide. And we follow up an outcome assessment by clinical evaluation, hemodynamic monitoring. We assess renal function and early complication with the patient. And we use statistical analysis by SPSS 31.0. And this is our result. And all patients with the age 60.2 years old. And the cardiovascular risk factor is hypertension is very high with 7.3%. And the symptom is the pain, especially the chest pain and abdominal pain. When we compare with some study, we have the same with some author from the Asia and in Vietnam. So our results compared to previous study in item of the age and the risk factor. However, the rate in our hospital with the critical line ischemia in our study is higher than some other study, which may due to more advanced disease and at the presentation. And about the aortic pathology on MSCT angiography, with dissenting thoracic aortic aneurysm, we have 45.9%, and with the abdominal aortic aneurysm, we have 35.1%, and with stenotropy aortic dissection, we have 18.9%. And we have there's a similar with some author, because the descending aortic aneurysm was more common pathology in the study, and proportion between groups were related comparable. So the descending thoracic aortic aneurysm were the most common in aortic pathology. The difference may be due to the variation in population characteristics, diagnostical imaging protocol, at the time of the patient enrollment. So the endovascular treatment strategy and technique. All mode of patients we use stent by stent graft with 86.5%, and we do 5 patients which rate is 13.5%, and the bilateral femoral artery asset with 91.9%, and the surgical asset for its for open explode is 8.1%, and the produce time nearly 100 minutes, and contract volume is near 118.5 minutes. So standard EVA and TIVA is a predominant treatment strategy, and bilateral femoral artery asset is widely used and fairly suitable. With procedure time and contact volume, our study is acceptable and comparable with some report and some study here. With the early outcome after intervention, with technical asset successful, we have a 97.3%, and the patient with a stable clinical outcome is 91.9%. It's very high. And so we have some complication, but I think that endovascular stent graft repair for aortic disease on MST angiography achieved excellent in early outcome with high technical success and stable clinical outcome, lower complication, and lower in-hospital mortality. And we want to show the complication after intervention. We have a 2K with hematoma around the femoral area with 5.4%. One patient have a acute kidney injury, but after that, the patient will be okay. And one patient have rupture of abdominal aorta and tear with iliac artery. And this patient is a male, is a male 80 years old, and he's suffering from the TAA with the diameter 6 centimeter and abdominal with diameter 3.5 centimeter, and the patient have a historical of coronary artery disease and vascular include disease. So during the procedure, the patient have the tear with iliac artery, and after that, we use the balloon to control the blood at the abdominal aorta, but after that, the patient have a rupture of abdominal aorta, so the patient must have an operation to repair the aortic abdominal, and after that, the patient must go to ICU, and he have died. So in this case, we want to assess that. We must do very carefully before procedure, especially we want to assess and optimize comorbid condition before intervention, and identify high-risk patients with a large aneurysm and complex vascular anatomy, especially with a serious aortic and iliac calcification. So this is our conclusion and limitation of this study. With endovascular stent graft repair is an effective treatment for aortic disease at our hospital with high technical success rate and low complication. either antiver and hybrids are minimally invasive shape and effects when performed in selected patients carefully. We have a limitation of our this study because we have a small size with only 37 patients and the time follow-up is very short. And this is a retrospective design, so its not outcome were fully assessed. So after my presentation, I want to have some session from the professor and all of our colleagues in this room. Thanks for listening.